Medicaid cuts threaten kids' health. A pediatrician's urgent warning. Prepare to be outraged. Our children's health is under direct assault. On July 4th, President Donald Trump signed into law the One Big Beautiful Bill Act, a decision that will slash nearly $1 trillion from Medicaid over the next 10 years. This isn't merely a policy adjustment. It's a bold and controversial move that strikes at the very heart of our healthcare system, especially for our children. Medicaid isn't just another government program. It is the backbone of healthcare in America. As the largest insurer for children in our country, Medicaid covers about 40% of all births and supports millions of routine doctor visits, hospital admissions, and therapeutic treatments. You might hear it called Healthy Connections in South Carolina or CanCare in Kansas. The name may differ from state to state, but the consequence is the same. Slashing Medicaid funding means reducing vital care for newborns, children with disabilities, and even hardworking families who depend on this lifeline. I simply cannot stand by while politicians in Washington risk the well-being of our most vulnerable citizens. Having worked nearly 2 decades in children's hospitals as a pediatrician, I have seen firsthand the irreplaceable role Medicaid plays. These steep cuts represent more than just a financial problem. They are a moral and political crisis. Although healthcare ideally should be about patient care rather than partisan debates, in America it has become deeply politicized, placing our children's lives directly in the balance. Our budgets reflect our values, and the One Big Beautiful Bill Act clearly signals that some decision makers do not hold our most vulnerable in high regard. But here's where it gets controversial. Reducing Medicaid funding by almost $1 trillion nationwide and cutting approximately $150 million from South Carolina's general care hospitals will have devastating consequences. Up to 20 million Americans are at risk of losing access to Medicaid. Rural hospitals already stretched thin will be forced to hire fewer nurses, respiratory therapists, and doctors, and some may even face closure. The impact? Crowded emergency rooms, delays in life-saving surgeries, and a system pushed to its breaking point. When preventive care is taken away, minor issues escalate into emergencies, eventually burdening everyone with higher cost and more complexity in care delivery. These cuts don't actually save money. They simply shift the financial and human costs onto patients, parents, providers, and communities already fighting uphill battles. Without proper access to Medicaid, children miss out on routine checkups that catch problems early, leading to more severe and expensive health crises later. This is not just a numbers game. It's about the lives of real people and the future of our entire healthcare system. So, what are physicians to do? We can no longer remain passive observers. Our role must extend beyond the exam room, becoming active participants in the political process. The decisions that are reshaping our healthcare system are being made by individuals who have never walked a hospital ward. And that disconnect is costing lives. It is imperative for doctors to join forces with organizations like the American Medical Association and specialty-based groups to gain the training, talking points, and real-time support necessary for engaging in honest, proactive conversations with families about the real impacts of Medicaid cuts. And this is the part many people will hear. Medicaid cuts impact. Durbin and Duckworth seek hospital data on Trump's One Big Beautiful Bill Act. In a bold move that could reshape healthcare in Illinois, Senators Dick Durbin and Tammy Duckworth are urging hospitals across the state to provide insights into the anticipated effects of a staggering 19% reduction in federal Medicaid funding, as outlined in President Donald Trump's ambitious One Big Beautiful Bill Act. This morning, the Democratic senators dispatched a letter to every hospital in Illinois seeking comprehensive details regarding the potential consequences of a newly enacted tax and spending package that slashes approximately $1 trillion from Medicaid and $300 billion from the Affordable Care Act, the ACA, over the next decade. The letter emphasizes that the act will impose cuts that freeze and diminish provider taxes and state-directed payments, which are crucial for hospitals in Illinois to sustain the Medicaid system and compensate for low reimbursement rates. The senators are concerned that these changes will lead to an increase in uncompensated care costs, driven by stricter Medicaid eligibility criteria and rising out-of-pocket expenses for both Medicaid and ACA beneficiaries. To better understand the implications of these cuts, they are requesting responses from hospitals by August 22nd. Specifically, the letter inquires about the percentage of inpatient and outpatient services funded by Medicaid, current operating margins, and projections for 2028, 2031, and 2034. It also seeks estimates of annual losses due to the new law, anticipated increases in uncompensated care, and potential service reductions. Notably, the senators are particularly interested in how these changes might impact obstetrics, labor and delivery services, and emergency room wait times. Moreover, the letter addresses the potential ramifications of further Medicaid or ACA cuts that Congress may consider, including the possibility of reducing or eliminating the 90% federal cost sharing for states that have expanded Medicaid. In their correspondence, Durbin and Duckworth present their own alarming projections, indicating that around 15 million Americans could lose their health insurance coverage, with approximately 500,000 of those individuals residing in Illinois. They also estimate that the healthcare sector may see a loss of 30,000 jobs over the next 10 years. The letter poignantly notes, for rural hospitals, which often serve as the largest employers in their communities, this situation could be catastrophic. A recent report from Costco, published on July 16th and updated shortly thereafter, that delves into the specifics of a $50 billion rural health transformation program that was incorporated into the bill just before its passage. This fund will be managed by the U.S. Centers for Medicare and Medicaid Services, CMS, with half of the total amount, $25 billion, allocated equally among states that submit approved applications. The remaining $25 billion will be distributed at the discretion of CMS, following the approval of state communication services and rural health plans. According to KFF, this $50 billion fund is expected to cover just over 1/3 of the projected loss in Medicaid funding for rural areas. However, the report also highlights that many details remain ambiguous, and the law does not mandate CMS to disclose how allocation decisions will be made. This situation raises critical questions about the future of healthcare funding in rural communities. How will these cuts affect the sustainability of hospitals that are already struggling? What measures can be taken to ensure that rural populations continue to receive adequate healthcare services? We invite you to share your thoughts and opinions in the comments below. Families fight against Medicaid cuts. A personal story. Imagine being forced to choose between your career and your child's life-saving care. This reality is looming for countless families who rely on Medicaid. Meet Calvin Latham, a child born with a rare neurological condition that requires constant medical attention. His home-based support, including specialized equipment, therapy sessions, and in-home caregivers like Bruno Gutierrez, depends entirely on Medicaid, a decades-old program now under threat. President Trump's signature One Big Beautiful Bill promises sweeping changes, but families fear it will unravel a lifeline. If these cuts happen, Calvin's mother, Lindsay, says she'll have no choice but to quit her job to care for him full-time. I'd lose my career, he admits, her voice cracking at the prospect. But how else could we afford his care? For Stacey Staggs and her family, the stakes are equally dire. Their 11-year-old daughter, Emma, relies on reinforced breathing vests, nutrient-rich formulas delivered daily, and intensive therapy sessions to manage conditions that leave her unable to eat or breathe independently. At Shining Hope Farms, an innovative North Carolina therapy center, Emma uses trampoline exercises for balance training and horse grooming sessions to improve motor skills. These routines, covered by Medicaid, are about more than health. They're her connection to a childhood others take for granted. But here's where tension rises. Some lawmakers argue cuts are necessary to balance budgets and reduce dependency on federal programs, while families counter that these aren't discretionary services, but medical necessities. You can't put a price on keeping our children alive, Stacey says, her voice firm. Her family joins Little Lobbyists, an advocacy group storming Capitol Hill to plead their case. The protest scenes tell the story. Calvin exercising his right to scream, laugh, and rally outdoors. Stacey cradling Emma, her tiny daughter supported by oxygen tubes and a minimally verbal but aggressively engaged spirit. Every caregiver photo, nurses braiding hair mid-treatment, parents locked in toy battles to stimulate engagement, becomes visual testimony to the unseen battle Medicaid families wage daily. Why is this controversial? Disagreement erupts over whether financial responsibility trumps healthcare access. Critics warn these cuts could leave families bankrupting themselves to survive. Supporters argue states should handle these costs independently. The real gut check question: when global congressional bills swap equality for efficiency, who loses their right to medical dignity? One thing's clear: these families won't tire. They'll share their stories, storm legislatures, and beg for understanding. The question remains: will their voices be heard before the life support systems holding them together disappear? Note names, dates, locations, and medical details preserved per original content.